Afternoon. Thank you for joining us for NAMI Maryland's 39th annual conference. My name is Bill Fluke. I'm a volunteer with NAMI Maryland. I'll be your moderator for this session today. This workshop session is Trauma and Mental Health Impacts on Youth, presented by Gloria, CO, LCSW-C from Equilibrium Mental Health, LLC. You can read more about all of our amazing presenters, including their full bios, in the digital conference program on the official conference website. This workshop will provide general information about trauma, as well as symptoms in children and adolescents who have experienced trauma. Evidence-based trauma-informed interventions to reduce symptoms and behaviors related to trauma will also be reviewed. If this is not the workshop you meant to attend, please click the back button on your browser or click on the conference dropdown on the left side of your screen and select sessions from the menu to return to the full list of workshops. We'll be addressing questions at the end of this presentation. If you have any questions as the presentation proceeds, please post them on the social wall on the right-hand side of your screen. We'll be reviewing the questions as they come in, and if something in particular is unclear or needs to be expanded, we'll ask our presenter after the presentation has concluded. If you have any comments, concerns, or technical issues, please post them on our social wall as well, and our technical assistant will address them accordingly. When posting on the social wall, please be aware there's a 20 to 30 second delay between presentation and the stream on Conference Tracker. When this workshop session closes, you'll be prompted to fill out a brief survey. If you would like to receive CEUs for this workshop, you must complete this survey in order to qualify. I'd like to welcome our presenter for this workshop, Gloria, CO. Thank you so much for joining us today.
Thank you so much for having me. Thanks for the intro, Bill, and all that information. Again, so we'll have all questions at the end. Please feel free to ask any questions that may come up, and I'll do my best to answer them at the end of this presentation. So as Bill said, this presentation is on trauma and mental health impacts on youth during these difficult times. This is just a presenter disclosure. There are no relationships to disclose at this time. The agenda for today is to review symptoms and behaviors in children and adolescents who have experienced trauma. We're going to review appropriate evidence-based trauma-informed interventions to reduce symptoms and behaviors related to trauma. We're going to go into specifics about impacts of COVID-19 and current events. And then we're going to go over a few ways that you can help. So what is trauma? The basic definition of trauma is that it is an actual or perceived threat of danger which overwhelms a person's usual coping ability and impacts functioning. Trauma can be different for anyone. It really is if that person's experience was traumatic for that specific individual. So even if a group of people go through the same thing, some people may experience that as a trauma while other people are able to cope okay with that. So again, it is a person's perceived threat of danger. What is a traumatic event? So a traumatic event is a frightening, dangerous, or violent event that poses a threat to a child's life or bodily integrity. Here is a list of different traumatic experiences. Traumatic experiences can include physical abuse, sexual abuse, including sex trafficking. In the past, sex trafficking was considered a crime. At this point, it is a reportable, you can actually report this to Child Protective Services. Psychological abuse, neglect, natural and technological disasters, terrorism, family or community violence, sudden or violent loss of a loved one, substance use disorder, refugee and war experiences, serious accidents or life-threatening illnesses, and military family-related stressors. So these are just examples of traumatic experiences that we commonly see. On top of those that were listed in that list of traumatic experiences, COVID-19 is a new, more recent trauma that we've seen a significant increase in since the pandemic. COVID-19 has created psychological and social effects, and it's been associated with distress, anxiety, fear, depression, insomnia, social isolation, and just chronic stress in general. And this leads to the development of exacerbation of depressive symptoms, anxiety, substance use, and other psychiatric disorders. COVID-19 has resulted in thousands of children being separated from loved ones who require isolation or are hospitalized. Those have parents that are working in the front line as doctors, nurses. And so there's been a lot of different ways that COVID-19 has impacted our youth. It's just been a huge disruption to their life with, virtual learning, being isolated from friends, not being able to see family members, all of those things that even impact us as adults as well. Another more common thing that we're seeing, racial trauma has been around forever, and due to current events, we've seen a significant jump in this as well. Racial trauma is a form of race-based stress, which refers to people of color and indigenous individuals' reactions to dangerous events and real or perceived experiences of racial discrimination. Such experiences may include threats of harm and injury, humiliating and shaming events, and witnessing racial discrimination toward other people of color and indigenous individuals. Unfortunately, racial trauma carries psychological and physiological effects, and several racial trauma effects such as hypervigilance to threat, flashbacks, nightmares, avoidance, and somatic expressions such as headaches and rapid heartbeat, among other things. And many of the symptoms are similar to that of PTSD. Although it's very similar to post-traumatic stress disorder, racial trauma is unique in that it involves ongoing individual and collective injuries due to exposure and re-exposure to race-based stress. So trauma is very, very prevalent. And here are some statistics on that. So 2/3 of children report at least one traumatic event by the age of 16. 8 to 12% of American youth have experienced at least one sexual assault. 9 to 19% have experienced physical abuse by a caregiver or experienced physical assault. 38 to 70% have witnessed serious community violence. 1 in 10 has witnessed serious violence between caregivers. 1 in 5 has lost a family member or a friend to homicide. And 9% have experienced internet-assisted victimization. So that's just a little background on trauma. And now we are going to jump into signs of trauma in children and adolescents. I've broken it down into different age groups, and I want everyone to just keep in mind that these are just examples. The prime thing to think about when you are working with children and adolescents is to see if you notice any significant changes in their behavior and presentation. So that is key. So even though I'm going to go over some specifics, if you feel that the child that you are working with or that you are taking care of is behaving very, very differently from the norm, that could also be a sign. So signs of trauma in preschool age children, they may have an increase of fear of being separated from their parent or caregiver. So again, there is some normalcy for preschool age children to have some separation anxiety, but if you're noticing like a significant increase in that, that could be a sign of trauma. They may cry or scream a lot more than they usually did or do. They eat poorly or lose weight. They may have nightmares, and there may be some regression in bathroom habits. Signs of trauma in elementary school age. These children may become more anxious or fearful. They may feel guilt or shame, and it's uncertain what it might be about. They have a hard time concentrating. So especially those kids that used to do really well in school and all of a sudden they're struggling, they're saying they can't pay attention, they're getting distracted easily. They have difficulty sleeping. So again, they could have difficulty falling asleep or staying asleep. They may have nightmares, and sometimes they exhibit problematic behaviors. They act out at school, at home, in the community, and it's behaviors that are out of their typical behaviors. Signs of trauma for middle and high school aged youth. They may feel more depressed or alone. They may isolate themselves. They may develop eating disorders or self-harming behaviors. They may begin using alcohol or drugs. They may be acting out sexually, engaging in high-risk sexual behavior. And, you know, again, the key for these kids, no matter what the age is if you know that there are significant changes in their behaviors, those are warning signs, and it may be a good idea to check in on them. So evidence-based trauma treatments, I feel like this is something really helpful to talk about. I think that sometimes parents, mental health professionals, they know that a child needs help and they may have experienced trauma. And I feel like it's helpful to just kind of go over what is out there that kids can, you know, or parents and adults can look into to set kids up with appropriate services. So the evidence-based trauma treatments that I'm going to be going into a little bit more detail today is trauma-focused cognitive behavioral therapy, TFCBT, child-parent psychotherapy, CPP, parent-child interaction therapy, PCIT, and dialectical behavior therapy, DBT. So for trauma-focused cognitive behavioral therapy, we call it TFCBT for short. It's an evidence-based treatment for children and adolescents between the age of 3 and 21 who are impacted by trauma and their non-offending parent or caregiver. Research shows that TFCBT successfully resolves emotional and behavioral difficulties associated with single, multiple, and complex trauma experiences. TFCBT is the gold standard in trauma treatment. This is like the frontline defense, like so many people get trained in this treatment model, and many therapists out there have this training and are able to treat kids with this model. You work with both the caregivers and the child and use gradual exposure approaches to reduce symptoms. I find this treatment extremely helpful and effective. You typically meet with the family one time per week, and it ranges from 12 to 25 sessions. Again, this is just an estimate. Some dependent on who you are working with, it can be shorter or longer. This is the average time. And each session is typically 1 to 1.5 hours long. In child-parent psychotherapy, this can be used to treat children 0 to 6 years old. This is because there's a big parent component to this model. And this model was designed for children exposed to domestic violence, but now it's been used with children that have experienced any early childhood trauma, and typically with a parent and caregiver who also has experienced their own trauma. The big parent component in this that is super helpful is that if the caregiver has their own trauma experience, the clinician working with them focuses on stabilizing the caregiver first by processing their trauma and talking about parenting before they get into the work with the child. The sessions, there's typically 52 sessions, so it takes about a year. And the sessions are, again, 1 to 1.5 hours long. Parent-child interaction therapy, PCIT, is targeted for families with children ages 2 to 7 with oppositional, defiant, and other externalizing behavior problems. It runs between 14 to 25 sessions, but it is not time limited because it's based on parent mastery of skills. In this model, it emphasizes improving parent-child relationship and changing parent-child interaction patterns. This model is very different than most therapy models that people are familiar with. It involves a one-way mirror where the clinician is behind the mirror and watching the interaction of the parent and the child while they're coaching. They have an earpiece in their ear and they're live coached with the interaction so that they can master the skills in this treatment. This is very helpful for that 2 to 7 age range that have experienced trauma, because many times that age range exhibits trauma symptoms and in externalizing behaviors. So they may be acting out more, they might be more defiant. And so this treatment model is very good for that population. And it addresses the trauma by working on building attachment with the caregiver and providing predictability and consistency, which is very important for kids that have experienced trauma. So sometimes with the younger children, if they have a lot of externalizing behaviors, it's really hard to effectively implement other treatment models. So sometimes managing those externalizing behaviors first is the most important to provide some stability to the family before doing more intense trauma work with the child. So it doesn't directly treat trauma symptoms, but because of the overlap in presentation with a lot of those externalizing behaviors in kids that have experienced trauma, sometimes kids benefit from PCIT. So dialectical behavior therapy for adolescents, DBTA. Dialectical behavior therapy was developed by Dr. Marsha Linehan in the 70s to treat adult borderline personality disorder. Research showed that it could be effective with teens that have severe emotional and behavioral dysregulation. So Alec Miller and Jill Rathas developed an adaptation for adolescents. And so DBTA involves individual therapy, group skills training, which is with the family. So there's multiple different families participating in the group and learning skills. And there is a phone coaching component where the adolescent can reach their therapist 24/7 in case there are any crises. And there's a consultation meeting where the DBT therapists meet to talk about their cases and support one another through the treatment model. In my experience, I have seen a significant jump in DBT cases just because the increase in depressive and anxiety symptoms due to isolation and just the pandemic in general. A lot of kids are experiencing suicidal or parasuicidal problem behaviors, and DBT is the most effective to treat that. So out there's a lot of DBT informed treatment or DBT light. I think that's what people have been saying. You want to look for a comprehensive DBT program that provides all of the 4 components that are listed on this slide. Another adaptation to DBT that is fairly new is dialectical behavior therapy for pre-adolescent children, and that's for ages 6 to 12. And so this treatment model was developed by Francesca Paraplechikova, and she adapted the model to really work with kids that have disruptive mood dysregulation disorder. So again, we are seeing more aggressive, suicidal or parasuicidal problem behaviors in younger kids as well. And so the DBT-C, so DBT for children model is actually really effective as well. In that model, it's very similar. There is not the multifamily skills group. However, there is skills training individually with the child or with the family unit. And there's a heavy parent focused piece where you do parent training to provide them skills to really support the child that has those really aggressive and externalizing behaviors. So we've seen a really big jump in DBT-C and DBTA needs, and it's been super effective for kids. So again, looking for a comprehensive DBT program that provides this really helps with managing some of those trauma symptoms, especially if they're more higher risk. All right, so COVID-19 impacts on treatment. It's impacted treatment a lot. So basically last year when everything shut down, services were all transitioned very, very quickly to virtual sessions. There's been an exacerbation in symptoms. There was a lot of unknowns. So, kids were feeling more anxious, more depressed. And even when they asked their caregivers or adults for answers, no one really could answer those questions, which caused even more distress. The virtual presence, it was so quick and overnight that, it took a bit to get used to. I personally just love having therapy in person. So it was a difficult transition, not just for the kids, but I think also for the adults as well. And what we saw was a regression in progress in treatment, because instead of having a safe place where they could go and talk to someone for an hour, they were doing the therapy in their safe space, in their home, in their room. Many of them were, paranoid someone might be here listening to them outside, or someone could overhear them. So there's a lot of, and there's lots of impact, a negative impact on treatment. The distance learning also caused Zoom fatigue, where they were on Zoom all day long, or Google Meets, and then they had to sign on again after school or before school for therapy, and it was just too much Zoom for them. Again, lack of childcare also impacted treatment. Families couldn't come in, or parents couldn't participate because there were other kids at home because they weren't in school. And so with many of the treatment models that I discussed, there's a lot of parent involvement. And so with the lack of childcare, those families that had other children in the home, it's really hard for parents to fully be present and participate in the sessions. And so that definitely impacted treatment as well. So going into ways to help, these are just very straightforward ways to help children and youth feel kind of a little bit better as the pandemic continues. With all the new variants, I think that although it seemed like things were getting better, a lot of the kids that I've been seeing have, again, have exacerbated symptoms of anxiety because of more unknown things that are coming up. So the first thing is to just make them feel safe. Just reassure them that they'll be okay. The second thing is just act calm. A lot of times we're not calm either. We don't know what's going on, and we're stressed out and we're nervous as well. Even if you are stressed or worried, or you don't know what's going on, try to act calm around them so that you are not modeling for them behaviors and, increasing their anxiety about what's going on. Maintain routines. I feel like this was really, really hard to do. There's been so many changes with people's work schedules, working from home, and then with school on Zoom. I think there's been a little bit more normalcy this year with kids returning to school. So just maintain routines as much as possible, whether you have to make some adjustments or not. Having a routine helps, structure the day and helps decrease anxiety, because at least kids know what is happening throughout the day. So that can be really helpful. And even if you may not have a specific routine that you go through every day, talking to your kids and just giving them a heads up about what to expect for the day can also be really helpful. Help them enjoy themselves despite isolation or having to, cancel travel plans, things like that. Kids may not know what to do. I'm so bored, I don't know what to do, I can't go hang out with my friends. So helping them find things that they enjoy. I know a lot of parents have been stressed about the amount of time the kids have been on screens, and they continue to be on after school playing video games, social media, all of those different online platforms that kids engage in. So helping them identify different things that are off screen that can be helpful, sports, going outside for a walk, that kind of thing can also help. Talk to them about, share information about what's happening. So everyone has access to, things that are happening, because most kids have phones, smartphones, the TV is on, and it's already being talked about. And so what would be helpful is to actually talk to them about what's going on in an age appropriate way, instead of having them find information out on online platforms. A lot of parents or caregivers and adults think that, shielding information and not telling kids everything is more helpful. However, that can actually increase anxiety, because then they're not having their questions answered. So just doing it in an age appropriate way, sharing enough information where they feel reassured. You don't have to explain the ins and outs of everything, but answering their questions and sharing information can also be very helpful. and pick good times to talk. Again, I mentioned like kids being on screens and like doing things and having fun. If you're trying to have a conversation with them while they're engaging in preferred activities, they're not going to want to talk, and they're probably just going to get annoyed, and people, like, it's just going to turn into an argument. So making sure that it's a good time to talk where the adult is also in a good headspace as well as the child, so that you can have a productive conversation and really be able to understand what's going on with them. Like I said earlier, with some of the symptoms, some kids do a really good job of making it look like everything is fine. Their grades are still good. They seem like they're still hanging out with friends. And they don't want to stress their caregivers out. So making sure that you have times where you're checking in on them, where they're not engaged in other preferred activities, and you're able to check in and make sure that really everything is okay, is also really helpful. All right, so I said that it's helpful to share information, and at the same time, trying to limit exposure to news coverage can also be helpful depending on the age, right? So if they're younger kids and they're just looking at news and that it's causing them more anxiety, worries, they're scared, it can be really triggering, especially because online you can access anything. So if there's a violent video, if there's there's news coverage and it's not really necessarily filtered very well, then they're getting just all the information up front. And so it can be really triggering, and it's very sensitive. So again, making sure that you know what your kids have access to. You may not be able to prevent everything. And again, that's why those conversations can be really helpful, because one of the kids may actually share with you that they saw something that was really traumatic for them, or they had, it was a trigger for them and it was really upsetting. So trying to prevent and limit exposure and providing them the information yourself in an age appropriate way is more helpful. Understanding that every child copes in different ways. Again, like the symptoms that I mentioned before can look different in every child, no matter what age. And so recognizing your specific child, the student, or whoever it is that you're working with, noticing if there's any changes, and being present, right? So we're all very busy. We're all dealing with all the stressors of what's going on in the world today. And so just saying, hey, how are you doing? And then they're like, I'm fine, isn't the best way to check in, but actually having conversations. And then if they're not able to cope, and they don't know what to do to manage their emotions, then helping them find ways to understand their emotions, discuss ways that they can manage their emotions. And if you're not able to help them directly, setting them up with services so that they can learn ways that are more healthy and helpful. Listen well. This seems very, very basic, right? And I think this is really hard to do. When I'm saying listen well, you want to be 100% present. So with everything that's going on, you don't want to miss any signs that something's wrong with your child. And you don't want to be distracted when your kid is trying to tell you about something that is bothering them. So making sure that you're fully present, you're making eye contact, your body is face towards them. You're not checking your phone or smartwatch or emails that are dinging. And if you can't listen fully and presently when they come to approach you, letting them know that what they say is really important and that you'll get back to them is more effective than half listening while you're multitasking on other things. Next is help children use coping skills. Again, there's so many different things online. There's so many online resources on coping skills, whether it's paced breathing, progressive muscle relaxation, different mindfulness activities. So there's so many different resources. The big trend right now are all those million fidgets that are available online. And that's been really helpful actually as well, especially with kids that are super anxious because they literally have something in their hands that they can fidget with. And there's so many different kinds, so that if they are really stressed and they get bored with one thing, there's so many other options that they can choose from. So helping them use coping skills, again, if you're having conversation with the kids about what's going on and what's bothering them, you'll be able to notice when things seem a little bit off. And you can also suggest using those skills in the moment. So it's like live coaching in the moment, helping your kids use those skills, and you can use skills with them together as well. Acknowledging what your child is feeling. Validation is something that I find extremely important no matter who it is that you're talking to, whether it's your child, whether it's a colleague, whether it's a spouse, friend. Validation is just acknowledging that you understand what the other person is feeling, thinking, or going through. Validation does not mean that you are in agreement with what they are saying. So if a child got really upset and threw something against the wall, and you're validating you threw that against the wall because you're super angry, I get it. That does not mean you're saying that was okay. You're just saying, I understand why you did it. And then you're able to talk through it. When you use validation, it's really helpful because then no matter what age the child is, they feel completely understood. And even if you are giving them a reprimand or other suggestions, it is more likely for them to actually listen to you and try to do what you're saying if you validate first. If you jump in and try to provide suggestions or problem solve right away, the likelihood that they'll listen and actually try is lower. So validation is just letting someone know that you understand what they're going through, you get it, you understand that they might be feeling frustrated, anxious, and if you can connect it to like different things that you've noticed, or even connect it to things that you've experienced, that can be really helpful as well. And last, be honest and let them know if you don't have an answer. I talked a lot about, sharing age appropriate information and being available to answer questions and talk to your kids in whatever setting that you interact with children. But sometimes you can look up information together. You can just say, you know what, I'm not sure about that right now, but I'll get back to you. I'll look into it and I'll provide information for you. And so that is better than just saying, I don't know, and moving on, but like giving them some kind of timeline of like getting back to them or looking it up with them together. So all of these ways are just some examples of ways that you can help children. The biggest thing is just being present and like making sure that they know that you are really listening when you're having those conversations with them, and being supportive. Everyone copes differently and kids cope differently too. And so comparing with siblings is really not helpful, or comparing with other kids. So making sure that it's individualized and not saying, oh, you'll be fine, because then you're discounting what they're going through, even though it might seem like something small. Right now, what I've seen is even things that kids have been able to deal with fairly well in the past has been harder for most kids, just because of the year and a half of like barely any contact with their peer groups or family members outside of their immediate homes. And so making sure that you're validating that it's been a rough year for everyone, and that it's okay if there's been slip ups or you're not sure what to do. And I think that is really the most important thing, whether you find an evidence-based treatment or not. It's really just being there and being supportive to your child. So that is my contact information. If anyone has specific questions or anything, you can please feel free to email me. And that, I think, wraps up my presentation. So we can do a little Q&A.
Thanks, Gloria. That was a great presentation. A lot of really good information. We'd now like to open up the workshop for questions. If you do have questions, please post them on the social wall for this session to the right-hand side of your screen. And be aware when you're posting that there's a 20 to 30 second delay between the presentation and the stream and the conference tracker. So be patient as we review your questions and comments. If we don't have time to answer questions today, or you have a question later, feel free to contact us, name the session that you attended, and contact connection@namimaryland.org. And at this point, I'm not seeing questions in the chat. I have a question for you, actually, Gloria, and that is, when I worked in the Baltimore County Public Schools, most of the mental health professionals working in the school system had some level of exposure to the concept of trauma in kids. It was a fairly new thing when I was there. But there was some talk about doing some sort of screening, using screening instruments or questionnaires or something. I wonder if you could just speak to that. Are there effective screening instruments out there? Are there ones that are appropriate for school age kids? And just, what's your experience been with that side of it?
Yes, so the UCLA PTSD reaction index is the assessment tool that we typically use to assess for PTSD symptoms, and that is just based on the DSM-5 criteria. However, I believe in the past couple years there is a fee for accessing that assessment. There are some free trauma assessments available online. I'm blanking on the name. I just used it. But there are some free ones available online. The thing is, some kids don't meet full criteria for PTSD, but they do have symptoms of trauma. And so again, the most important thing is being able to actually identify if there was a traumatic event or experience in the child's life and if it's impacting them in any way. So even if it's just like nightmares, they wouldn't meet criteria for PTSD if they're only having nightmares. There has to be other symptoms that are being present to be able to be diagnosed with that. And so if there's any specific symptoms related to their trauma experience, they would be appropriate to receive trauma treatment. It does not mean you have to meet a post-traumatic stress disorder diagnosis to receive any of these treatments. You can get this treatment for anxiety, depression, any of those things if you have exposure to any type of trauma. And to be honest, COVID-19 trauma has been that's the majority of kids that we see right now.
I thought your point about a significant change in the child's behavior, emotional presentation, behavioral presentation. I thought that was a really good point, that is, it's been harder for teachers and school personnel to keep track of those changes given how disrupted school has been, but it's a really important set of criteria, both for parents and for anyone else working regularly with kids. Marty, I'm not seeing any other questions in the chat at this point.
No questions.
Well, it's been a very informative and helpful presentation. And I would say, I hope there's both parents and professionals in your audience that the information you've shared has been really helpful for both of them. I think what we'll probably do is start thinking about wrapping up. I want to thank everybody for joining us today. When this workshop session closes, you'll be prompted to fill out a brief survey. If you'd like to receive CEUs for this workshop, you must complete this survey in order to qualify. I also want to note the next workshop session will begin at 3:30. So you've got a little time. Be sure to check out NamiLand and other amazing virtual resources in our virtual exhibitor hall. And don't forget to participate in our resource scavenger hunt. If you find all the resources listed and submit your answers by the end of the conference, you'll be entered in a raffle to win a DSW messenger bag. Thank you again for joining us, and we hope you enjoy the rest of the conference. I'd like to thank everybody.
Thank you.
And really a pleasure hearing this presentation this afternoon. So thank you.
Thank you.
Okay. Well, I wish you luck, Gloria. It's fantastic that you're seeing clients for the most part face to face. I think that particularly with the population you're talking about, so important.
Right.